Positions for breastfeeding. Learning how to hold your baby in a comfortable position is especially important during the early weeks after birth. There is no one right position for all mothers. Use what works for you to feel most comfortable and also allow your baby to feed well. This video will show basic points important for any position and then show you several common positions that have worked well for many mothers and babies. Whatever position you use, your baby will feed most easily if you hold him securely, facing you, with his body in a line. When you recline, gravity helps keep your baby pressed against you. She can make her own way to your breast, open her mouth wide, attach, and begin suckling. When you're upright, you have a more active role in helping your young baby feed. Hold him close, facing and touching your body with his nose opposite your nipple. Your baby opens his mouth very wide, then tips his head back as you move him straight onto your breast. He is in a good position for feeding now, held securely with his head and body in a line. Good posture is important in upright positions. You'll find it's more comfortable to sit straight with something under your feet. If your baby's hand is between you, move it down to keep the closeness. Now, we'll show you the steps to hold your baby in several common positions. Especially in the early days, you may find it more comfortable to feed your baby lying in a semi-reclined position, with your body and head completely supported. Lean back a little, upright enough to be able to look into your baby's eyes, but leaning far enough back that your baby's whole body rests securely against you. Your chest is the special comfort zone for your baby, especially when you hold her skin to skin. This closeness helps calm your baby and stimulates her feeding instincts. She will often find her way to your nipple with your gentle support. Be patient as your baby settles. Find your nipple and attaches. You may find this position is easy for your baby to attach deeply, and it's also comfortable for you, particularly during the early days and weeks. If you've had a cesarean birth, your baby can be positioned across your chest and away from your incision. The next position is often called the cross cradle hold. This position helps to support your baby's body and is a good one when you are first learning to breastfeed. Hold your baby close to you, bringing her body tight to your chest with your elbow and supporting her head by placing your thumb and fingers around her neck and your open hand under her head. Your forearm supports your baby's weight. Position her nose opposite your nipple. Her head should be free to tip back naturally as she attaches to your breast. Hug your baby tight. This will improve her attachment. This mother holds her baby close to her, supporting his neck and head with her hand. She can easily see his attachment and good drinking. This position is also helpful if you have a small or a sick baby. third position is often called the cradle hold. This position is a very familiar one, but it gives you less control over your young baby's head. Hold your baby on your arm, with her head just below the bend in your elbow and your hand supporting her bottom. With her nose opposite your nipple, bring her straight to you as she attaches. Hugging her in tight improves the attachment. Straightening your baby's body and hugging her close improves this position. The underarm hold is next. This is also a good position when first learning to breastfeed. Your thumb and fingers are around your baby's neck, supporting her head. Position your baby beside you, tucked under your arm. Then push your baby's bottom against your side. Your arm supports her weight. Her nose is opposite your nipple. Now, bring your baby to your breast with a quick arm movement. This position gives you a good view of your baby's attachment. The mother positions her baby along her side. Putting a blanket or cushion under her baby can be more comfortable. Moving the baby's legs further to the back improves the attachment. This position can be helpful if you have large breasts, after a cesarean birth, or if your baby has difficulty attaching deeply. Last is the side lying position. Lying on your side can help you rest. Position your baby so she's facing you with her nose level with your nipple. Pull your baby close with your hand on her back. Your baby faces your breast. Her head is free to tilt back. Your hand on her upper back pulls her in close. This is a good position just after giving birth, at night, and after a cesarean delivery. Here are a few positions for holding twins. Cushions can be helpful to position your babies. Here, the babies are held in front. In this position, you support their heads while their legs are behind you. Remember, hold your baby close, facing you, with her head and body in a line. Position your baby with his nose opposite your nipple. A good position is comfortable for you and helps your baby attach well and feed effectively.